There we go. Okay. Okay, then we'll talk about advocacy when it comes to environmental health. So as we know our objectives, right, after reading this chapter, talking about this chapter, learning about this chapter, we should be able to. And there's your 4 objectives. Okay, so once again, let these objectives guide what we're learning about this chapter. Okay, so let's see where we're at. Okay, we do know that chemical, biological, and radiological exposures that affect our health come from, as we talked about, in the air we breathe, the water we drink, the food we eat, and the products we use, right? As nurses, we need to know how to assess for environmental health risks, right? And once we assess for those risks, we need to be able to develop educational plans and preventative interventions with regards to the community, whether that's individuals, families, or aggregates in the community, right? It's our responsibility to decrease the risk, right? Some general environmental health competencies for nurses. We need to have a basic knowledge and concepts, right? We should understand the relationship that we have as individual community members, our kids, with the environment, right? Including our work environment, right? And that means our basic knowledge should include exposures to environmental health hazards, basic prevention and control strategies. Okay, we should be able to do an environmental assessment and referral if need be. Right? How do you do an environmental health history? How do you recognize potential risks and hazards? And do you have the resources to provide appropriate referrals if there are environmental issues? Okay. And then the other health competency is your advocacy, ethics, and risk communication. You need to be able to demonstrate the knowledge of being an advocate, right? You need to be able to, if there's something going on in the environment, you are going to be responsible for communicating what the risks are to whatever population is going to be affected. And then lastly, you have to have an understanding of the policies and the laws in your particular community or your state related to environmental health. Okay, so there's 4 different competencies. Environmental health is a really big topic. I mean, think about your own community. Do you guys know what your community is at risk for with regards to the environment? Do you live near a highway? Do you live near a railroad? Do you live near an airport? Do you live near a waste site? Do you live in the industrial section? Does that make sense? Lots and lots of issues, potential issues. Okay. Oh, Healthy People 2020 comes up quick in this chapter, page 86. Objectives related to environmental health. We need to know these 6. I mean, these are environmental issues. Eliminate elevated blood lead levels in children. That's a huge problem in the environment, especially in the older homes, older schools. Right? Minimizing the risks for people who live near hazardous sites, pesticide exposure. Right? Pesticides are, depending on your rural, urban, right? Toxic pollutants reduce the risk of those released into the environment, reduce indoor allergen levels. Right, and the last one was reduce the number of homes that have lead-based paint or related hazards. So know these 6. Okay. So a couple of environmental health sciences, just a few that I just need you to know what they are. Okay, the first one is toxicology. Okay, and what is that? Toxicology is a science associated with chemical exposures. The health effects of chemical exposures. And then the second one is epidemiology, which we'll talk about in the next chapter. But epidemiology is the science that studies the poisonous effects of chemicals. Or excuse me, epidemiology is the science that helps us understand the association between the exposures, right? Exposures and humans. Okay, that's where we talk about the agent and the host and the environment. When we talk about the epidemiological triangle, how do the exposures affect us when we're exposed to them? We'll talk about that in the next chapter. Okay, this gives you a little bit of an introduction right here on page 88 about the epidemiological triangle. We'll talk about that more, but that's also associated with environmental health. Okay, here's your QSIN box. This is a targeted competency in this box is functioning effectively within teams. Okay, so have a look at this box. Excellent explanation of functioning within teams, the competency. Okay. Here they talk about climate change. Okay. We know that climate change is a significant and emerging threat to public health. This is a good visual right here, table 6.3, the impact of climate change on human health. Okay, goes through the three layers. So have a look at that. Nothing you need to memorize, but just being familiar with the impacts of climate change on human health. Okay. This is a couple of different ways that the environmental health assessment. Okay, in this paragraph right here, we can assess environmental health risks in three ways. Okay, we first can assess it by, we've already talked about the environmental factors such as the air, water, soil, or food. Okay, so those are considered your 4 environmental factors. We can also assess health risks by your setting. Do you live in the urban area, the rural area, or suburban area? Okay. And thirdly, we can assess health risks by location. Are you at home? Are you at school? Are you at work? Are you in the community? Each of these locations provides unique environmental exposures and overlapping. So lots of different ways there to assess environmental risks. Your 4 main factors, your setting, where you are, where you live, and your location, your specific location, home, school, workplace, community. Okay. This how-to box is an excellent source of how you apply the nursing process to environmental health. Remember, I told you guys, we have to apply the ADPI to every topic we're going to be discussing, right? So here they have it all broken out for you. How do you apply the nursing process to environmental health? Okay. So have a look at that. And then box 6.2 is what I need you to remember is what each letter stands for. You don't need to remember all the bullets under all these, but just understanding what the mnemonic is. So this is the I prepare mnemonic. Okay, and this is how you do an exposure history. All right, whether it's a current exposure, past exposure, whether you're trying to reduce or eliminate current exposures. Hang on a minute. Still trying to get people in here. Okay. Okay, so you can go through this, but for example, your eye, you're investigating potential exposures. So how might you get that information? Remember, you're doing an exposure history. So things like P, present work, where do you work? What are you exposed to? Where do you live? With the R, residence, where do you live? When was your residence built? What type of heating do you have? The E is environmental concerns. In your living environment, are there industries or farms or something near your home that might give you an increased risk exposure? What have you done in your past work? What activities do you like to do? Right? Here's the R is referrals and resources, and the E is educate. Okay, so understand what that I prepare mnemonic is. It's to establish a risk exposure, past or present. Okay, and then the next section describes each of the 4 environmental areas at length. Okay, it describes air pollution. Okay, it goes into water, what issues we could face with water contamination. And what I really need you to know is what these 4 factors are. All right, what can go wrong with the air? What can go wrong with the water? What can go wrong with the land? You know, think about I live near an old closed nuclear waste called Rocky Flats. They've spent 20 years testing soil to see if they could build residential communities near there. Finally, in the last couple of years, the first residential community was built over by Rocky Flats, but it took up to 20 years to get everything tested and approved. And, you know, who knows what I'm just starting to see this story a couple of weeks ago, or starting to read more about it, about this. Have you heard about this high school in New Jersey that middle to older age, 50, 60-year-olds are all of a sudden getting sick? They're getting sick with these rare cancers. Well, one of the classmates is an epidemiologist. So he's going back and looking and researching and doing studies, and they're finding that when they build, well, I don't think anything's concluded yet, but the thought is that this high school was built on land that was not supposed to be built on. What am I trying to think of? It was contaminated land. And so now they've got like 100+ graduates of this high school. The first couple of years it was built, the people went there, they're all getting these rare cancers. Pretty crazy. So those are the kinds of things that can happen. Okay. And then food, you know, we go into restaurants, we go and get takeout food, whatever. We just expect that everything's prepared right? All the temperatures are correct, the food's prepared right, the employees are washing their hands, and everything's cool. And that isn't always necessarily the truth, right? So we have to be careful of that as well. And then risk assessment, right? EPA, which we talked about, currently the EPA uses the process of risk assessment when it develops the health-based standards. And the EPA is the agency that develops health-based standards for environmental risk, right? And what is risk assessment? It's the process to determine the probability that there'll be a health threat associated with an exposure. So if you eat uncooked chicken, what is a health threat? Salmonella, right? And then this table, 6.1 talks about safeguarding, well, first of all, safeguarding women when they're pregnant. Think about it. Think about all the risks that you have in your community, your environment, and think of pregnant women are more at risk, for say a food contamination or a water contamination. Okay. And it's just real interesting. We talk about lead, right? Lead exposure can lead to this, right? Antiseptic compounds can lead to this. So this is just FYI. But we really, take for granted these pregnant moms and everything's going to be okay. And do we really think about these things? Okay. And then levels of prevention. Okay, so this is related to lead exposure, which is a common environmental risk, right? So let's walk through primary, secondary, and tertiary when it comes to lead exposure. So primary, remember, is to prevent. So to prevent, we would use only non-lead based paint, right? That will prevent any problems. Okay. However, secondary, if you find lead in the paint, early identification, early intervention. So we would remove the paint and replace it with non-lead paint, right? Then tertiary, we need to assume that they already have had a lead exposure. So what are we going to do? We are going to have to take steps to reduce the blood lead levels. Okay. Education is the key when it comes to reducing environmental health risks. Okay. We are seen as nurses are seen in the community as very knowledgeable, kind of the go-to people. Okay. People expect us to be able to articulate the relationship between exposures and possible health consequences. Okay. Part of our community nurse role is to educate families towards risk reduction. Okay. An example of that would be maybe helping a family, get carbon monoxide detectors. And then risk communication. What is risk communication? Okay. These are general principles of good communication. Okay. We need to be able to provide three things: the right information. It has to be accurate, relevant language that people understand. Okay. We need to make sure that it gets to the right people. Right. Especially those who definitely will be affected need to hear what's going on. And what do you do with those who may not be affected but are worried? Maybe they get a different version of the information. Does that make sense? As to not panic everybody. Okay. How are you going to get that information out to the right people? Flyers, newspapers, radio, television. And this just isn't like a weather related. Okay. Weather related is an environmental risk, but there are also many other kinds of risks. If you live near an airport, there's a plane crash. If you live near a railroad and there's a derailment, right? If you live in an industrial area and there's a fire. Okay. And then the other important piece of risk communication is at the right time. Okay. You have to be able to get your information out in a timely manner. That's why you see, that's why, when there's been an event, the emergency management system has been activated, whether it's a weather or a shooting or car accidents, whatever, they try and get those public information officers out in front of the public as soon as possible to start disseminating that information, right? Okay. This is an introduction to OSHA. We're going to need to know about OSHA. What do you guys know about OSHA in your workplaces? What do you know about OSHA?
They are the ones that put like safety in the workplace, like if you were to get injured on the job or other means of injury, they're there to protect you and have safe working environments.
Yep. Excellent. Make sure employers provide a work-free, as much as possible, work-free of hazards, with chemicals, noise, mechanical dangers, heat and cold exposures. They're all part of the workplace, but OSHA tries to ensure that all the appropriate protective measures are in place. Okay. We'll talk about them in OSHA in chapter 32 with occupational therapy, occupational health. Okay. And that's all I wanted to cover. Hang on a minute. Oh, that's in epidemiology. Okay. Anybody have any questions about environmental health? It's a lot to think about, right? A lot to think about, a lot of potential risks in the environment. I'm going to try and be really, really specific with this particular chapter because epidemiological applications can get pretty wordy and pretty confusing. So I think I've taught this chapter enough that I can really, really kind of hone in on what we need to pull out of this chapter. Okay, so what are the basic concepts in epidemiology? I'm reading right here from the outline, which is your PowerPoint. Okay, epidemiology measures morbidity and mortality, right? The other basic concept is the epidemiological triangle, which we'll review in more detail here, which is the agent, host, and environment. And what are the basic levels of preventative interventions we talk about in epidemiology? When we screen with epidemiology, what is reliability versus validity? And then what are some of our basic methods in epidemiology? How do we get our data? How do we adjust our data? How do we compare our data? Okay. And then these are two words we're going to need to know the difference of: descriptive epidemiology and analytic epidemiology. We'll talk about that in the chapter. Okay. So here's your objectives. So again, let your objectives be your guide to understanding the chapter. I'm trying to pull out the information that meets all of our needs so that we can articulate these objectives. Okay. Okay, first and foremost, this descriptive and analytic are mentioned several times in this chapter, but let's introduce this topic of epidemiology with describing these two. Okay. So again, epidemiology is what are the patterns of the health events? Okay, and how are those patterns influenced? Okay, so with descriptive, just think of it as the description. Okay, what's happening? Who is it happening to? When is it happening? Where is it happening? So you're trying to describe what's going on. Let's say it's COVID. Okay, it's the who, what, where, when. Where analytic is the why did it happen? How did it happen? Kind of thinking through, analyzing through how and why. Make sense? Okay. Healthy People 2020 comes up pretty quick in this chapter, page 148. Examples of objectives, epidemiologic objectives. Okay. And with these objectives, look at the last one, reduce invasive MRSA infections. Okay, increase the prevention behaviors in persons at high risk for diabetes with prediabetes. These are things that we might look at in the community to study. Okay, this is an excellent summary of nurses, what roles we might play in epidemiology. So I just want to read this to you. Nurses play a key role in the community's interdisciplinary team, looking into health, disease causation, and how to both prevent and treat illness. Nurses use epidemiology in the community to examine factors that affect the individual, family, and population group, because it is way more difficult to control these factors in a community than in a hospital. Right? Specifically, it's difficult to control the environment, as we just talked about, including water and food supplies, air quality conditions, pollutants, disposal of garbage and trash, insects and animals that carry infectious diseases, quality of paint used to ensure it contains no lead, or what comes in the mail. So, therefore, the community residents are often exposed to many other factors, or many factors affecting their health. So we're comparing this to, say, a hospital setting. Hospital setting is what this is saying is the hospital setting is a much more controlled environment, where you do have control of the airflow, right? You do have control of the water supply. You do have control of how hazardous waste is disposed of. But in the community, it's not always the case. Okay, so what epidemiology does, it looks at the risks, studies the risks, who is at risk and why are they at risk? Okay, we're looking at what caused the disease, how to prevent it, how to treat it. That's what epidemiology is about. Okay, so that's an excellent summary right there on page 150 of how we become involved in epidemiology and what specifically we do. Here's your case study. This is actually a good case study. This is the case study that I provided you the answers to in my email to you over the weekend with the PowerPoints. You don't need to go to the Evolve website to get these answers. I already provided you that. Okay, so this is a good case study. Have a look at it. Okay. So what are the basic concepts in epidemiology? Well, first, this was in the chapter outline. We know that epidemiology are measures of morbidity and mortality. So specifically, we would look at the rates that diseases happen, the proportions, and the risk. Okay. And I just need you to know the definition of each of these three, and I've highlighted it right here. Right? The proportion is the type of ratio in which the denominator includes the numerator. For example, if there were, let's say, 2 million deaths recorded in the United States, right? 631,000 were reported to have been caused by heart disease, right? So then you divide 631 divided by 2.4 million. So it's 0.26. So it's the proportion, it's the number of people. So it would be, let's look at infant mortality. So let's say you had 1,000 live babies born, and they're looking for an infant mortality rate, say in the first year. And there were, of 1,000 babies born, there was one baby that died. It's your proportion, 1 of 1,000. Okay. The rate is the measure of the frequency. Okay. The rate is a measure of the frequency of the health event in different populations at certain periods. And there's a table down below that we'll go through. I just want you to get these definitions. Risk refers to the probability that the event will occur. Okay, so you have proportions, rate, and risk. Okay. So here's the table 9.2. Please know these. Okay, you're going to be given a scenario on the exam, and it's going to ask you what are the most common mortality rates? Here they are on the left, and then here's how you set the equation up to get the number. So for example, let's look at case fatality rate. Okay, so the number of these are very, very simple. Okay, very, very simple. It looks busy. This looks busy, but it's very simple. Okay, so let's look at the case fatality rate. Number of deaths from a specific disease in a given period divided by the number of people diagnosed. For example, if 87 out of 100 people diagnosed with lung cancer die within 5 years, then the case fatality rate is 87%. Get that? So if 87 out of 100 people diagnosed with lung cancer die within 5 years, then since we've looked over 5 years, the 5-year case fatality rate is 87. Or let's say it said 3 years. Okay, then the case fatality rate is 87% over 3 years. Does that make sense? I don't want to confuse you here. Claudia, you look confused.
I am very confused.
Okay.
So
So-
you said that, go ahead.
No, go ahead.
So you said the number of deaths. So if it's 87 people
Out of
that
100.
die out of 100, then you would divide it by the 100,
Correct.
basically. Okay.
Correct. Yeah. So let's just say it's not even, there's no years. Let's forget the years. If 87 or in the first year, 87 of 100 people who are diagnosed with lung cancer, within the first year, 87 will die. So the case fatality rate, the death rate would be 87%. Right? And then your survival rate is 100 minus your 87. So your 13% survive, 80%, 87% don't. Okay, let's go up here to death rate. Number of deaths from any cause during a time interval divided by the population. This estimated mid-interval population, it means population. Okay, so for example, if there were 2.4 million deaths out of a total population of 275 million, right? You do the division, number of deaths, so 2.4 divided by 275, right? That's your 873 per 100,000. Make sense? Again, I don't want to get really bogged. I don't want to get bogged down on this because this is where this epidemiological stuff gets confusing. Okay, but think about it, age specific. You're talking about number of deaths among people in a given age group, right? So for example, let's say, let's think of suicide. Okay, so there were 100 deaths among kids 10 to 18. Okay, divided by whatever your population is from 10 to 18. So there were 100 deaths per 500,000 kids 10 to 18. Does that make sense? Okay. So just know what each of these are, okay? Be able to, if you're given a scenario, it's going to ask how are you going to look? How are you going to look at this? How are you going to figure that out? Well, I would use the cause specific rate, or I would use the case fatality rate. Okay. Okay, and here's the epidemiological triangle. Okay. Epidemiological triangle is your agent, your host, and your environment. Okay. The agent is what are we being infected with? Okay. There's a right here. Table 9.1 gives you an example of all three. Okay. The agent is, what's the infectious agent? Is it a bacteria? Is it a virus, fungi, parasite? Is it a chemical? Is it a physical agent? Is it radiation? Is it heat, cold? Okay. It's what's infecting you. That's your agent. Okay. And obviously you need a host. The agent needs a host to infect. So your host is us. So think of COVID. Okay. A host is us and our susceptibility, right? Does age play a factor? Does your sex play a factor? Does your immune status play a factor? Does your lifestyle, does obesity, diet, exercise? That's the host. You need a living organism to infect. Okay. And then the environment is the wild card. Whatever's going on in the wild card is going to affect, whatever's going on in the environment will affect the relationship of the agent and the host. Internal or external environmental factors. What's the climate? What's the plant? What's the animal life? What's the human population? Is it a crowded setting? Are there a lot of support, social support? What are the socioeconomic factors? Education levels, resources, access to care. What are the working conditions? Okay, what's the level of stress, the noise? Okay. So let's do a couple of examples here. Let's say our agent is machinery, physical agent, machinery. Your host is somebody with let's say, potential hearing loss, okay, because of the machinery. And they're working in an environment that has lots of noise. Lots of noise. Is that a problem? Yeah, of course it is. Let's say you have COVID. Let's say COVID is our agent. Let's say our host is a nursing home. Okay, is the general susceptibility going to be higher in a nursing home if COVID were to get into that nursing home? Of course. Okay, and the simple environment of it being a nursing home puts them at risk. All right, so your agent would be COVID, your host would be the elderly, and your environment would be a nursing home. Let's do another one. Let's say your agent is pertussis. Okay, your host is a school full of kids. Okay. And your environment is a particular classroom where 3 or 4 kids have been diagnosed with pertussis. Okay. Does that make the rest of the kids more at risk? Yeah. Okay. Does that make sense? So what we call the relationships between these 3 is called the web of causality. Okay, just think of it as a big spider web. Okay, meaning that, in a really big, beautiful spider web, there's just so many ways it goes. Well, think of all the different relationships that the agent and the host in the environment can have. Their relationships, depending on the agent and the host, will determine how serious this is, how not serious this is. So again, going back to COVID, your agent is COVID. Let's say you have 2 different hosts. One are the elderly, and the other are healthy high school kids. Okay, but so these healthy high school kids are going to be much less impacted by COVID than the elderly population. That's that web. All right. It can look many different ways. There's many different outcomes from these relationships. Okay. So that's what that means. Okay. I'm going to go to the primary, secondary, tertiary level box, but I want to show you on page 156, they have a really nice, again, description of primary, secondary, and tertiary. Okay, we know that primary refers to interventions that promote health and prevent the occurrences of disease. But it just gives you a little bit more description if you're wanting to understand a little bit better about primary, secondary, and tertiary. Okay, here's your secondary. Okay, refers to interventions designed to increase the probability that a person with the disease will have that condition diagnosed early, right? Early enough that the treatment is likely to result in a cure. So early identification, early intervention. And then tertiary. Includes interventions aimed at limiting the disability and interventions that enhance rehabilitation from the disease, injury, or disability. So again, just a little bit more detail in each of these. Okay. And here's your difference between, this is one of our objectives. Okay, what's the difference between validity and reliability? Trying to get that highlighted. Here's your difference. Valid. These are characteristics of a successful screening program with epidemiology. Okay, valid means accurate, high probability of the correct classifications of persons or persons tested. And reliable, it's precise. So your definitions are on page 158. Results that are consistent from place to place, time to time, and person to person. Okay. If you want to read more about that, the next section below that gives you more detail on both of those. Okay, we need to know the difference between both of those. Okay. And then the next, this section, starting on page 160, really goes through in detail about descriptive and analytic epidemiology. Okay, person, place, and time. That's what we need to know about descriptive. Who is affected, where were they affected, and what time were they affected? Time frame. Okay. So as I said a little while ago, this type of epidemiology provides a picture of how things are or have been. The who, the where, the when of disease patterns. Okay. Whereas in contrast, analytic looks to the how and why. How did this happen? Why did this happen? Okay. And so descriptive talks about the person, the place and time. And then this section goes through the person in more detail, the place and the time. Okay. And then you have your section on analytic, okay, which we went through, the how and the why. Okay. So we do need to know the difference between our study designs. Okay, and there's 5 of them, and they're summarized in this box 9.3. Okay, the ecologic is the most common. This is what nurses use most. If you are doing epidemiological studies in community public health, nurses are going to be using the ecologic model. It's quick, it's easy, it's inexpensive, right? And the data is usually very readily available for us. Okay. What I need you to know about this box is that there are 5 and what each one represents, like a retrospective study. For example, let's say you were going back in time. So I used to do retrospective studies in the school clinic. Let's say we had an outbreak of pertussis. I would go back and look at the health logs, maybe to see, did we have kids coming in day after day after day after day with coughing? Were they in the same class? You know, could this have been something that started in this particular way? Okay. Retrospective. Okay. Prospective. Okay. So know the difference in each of these. And I told you about the ecologic. There, after this box, it goes through each of them in a little bit more detail. Okay. Okay. And I believe that that is all we're going to cover in this. Well, let's do levels of prevention. Okay. They're talking about cardiovascular disease. What does primary prevention level look like? Discuss low-fat diet and the need for regular exercise with clients. Right? Implement blood pressure and cholesterol screenings. Tertiary, provide cardiac rehab, medication, and surgery. This is to a person who already has cardiovascular disease. Then our CUSIN box, here the competency is informatics. Okay, this is one of the competencies, using information and technology to communicate, manage knowledge, and support decision-making. Okay, so this is a good box if, pardon me, if you would like a little bit more information. A lot of people, a lot of students got this particular question wrong on exam 1, where it was that select all that apply. By the way, don't be afraid to select all, everything in a select all that apply. It is possible. There were 2 questions on exam 1 that select all that apply that ended up being all the choices. And this is one of them. Okay, a lot of people missed informatics as a competency. Informatics is a huge safety and education, quality safety and education competency for nurses. It's all about data, right? Charting, to communicate to the rest of the team. Informatics is used in many, many ways in nursing. Okay. And here's your knowledge. Identify essential information that must be available in a common database to support client care. Right? Isn't that our documentation? Okay. That's our epidemiological chapters. Anybody's brain spinning at this point with epidemiology? Epidemiology can be hard to grasp, which is why I try to really hone in on the essential concepts and topics that we needed to cover. Let me do a check-in. How's everybody doing?
Good.
So far, so good.
Okay,
You're
okay.
still in there.
Still hanging in there. Hang in there, guys. Got one more chapter to cover. And this is, I would say that of all the roles that we talk about, the faith community, the school nurse, the hospice nurse, the home health nurse, and now your occupational health nurse. The occupational health nurse really has a big, big role. Okay, what is she responsible for? She's responsible for the workplace, the work environment. Okay, she needs to know who's working in what part of the building. What are their risks? Let's say they're in a big car power plant, manufacturing plant. Who's working where? What are the health risks in each different part? What are the health risks of each job in the facility? What are the health histories of people? What does she need to know? What are the safety risks? You know, who's been injured on the job? Okay. Huge, huge. And in your big, big corporations, you have really an occupational health team. Think of when you get hurt on the job and you're sent to the occupational health department. It's usually a doctor, a nurse, could be many members of a team. Okay, so that's what occupational health is. It's out in the workplace, out in the work environments. Okay. The nurses need to be aware of what the characteristics are of the workforce, characteristics of the work. What are the work health interactions? And again, host, think about the epidemiological triangle. Okay, the host agent environment plays a big factor in occupational health. The nurse will likely be very involved in development and implementation of on-site occupational health and safety programs. You know, what if you're working with heavy equipment? Don't you want to teach the employees how to lift properly so they don't get hurt? How do you do a worker assessment? How do you do a workplace assessment? Really important stuff. So here's your objectives. Again, we'll cover these hopefully as we go through the chapter. Okay, so occupational health nurses work in traditional manufacturing, industry, service, healthcare facilities, construction sites, and government settings. I had a student in my earlier class today whose aunt works in the government in Washington as an occupational health nurse. She said the view out her window is the White House, which I thought was very interesting. So she works in the occupational health department in the government right at the White House, close to the White House. Okay. What might occupational nurses do? What might be their scope of practice? Well, we talked about worker and workplace assessment, surveillance. They may be doing primary care, case management, consulting, counseling, and so on. Have lots of potential different hats to wear. Like roles in professionalism in occupational health nursing, like faith-based nursing, like school nursing, like hospice nursing. Occupational health also has its professional standards and professional organization and scope of practice. Okay. Code of ethics. And here we describe, we talked in community health about maybe the homeless population, the teen pregnant population, the mental health affected population. In this particular chapter, our population are workers. Okay, so we address workers as a population. Okay, so industries traditionally have been manufacturing, service, agriculture, construction, high-tech firms. Okay. What are some characteristics of the workforce? We know that the workforce is rapidly changing. Wow, sorry about that. We know that the workforce is rapidly changing. Right? So all the changes in the characteristics of work we're now seeing many new occupational hazards. This is one of your attestation questions today, right? This change in the nature of work has been accompanied by many new occupational hazards. And there's 6 of them listed. Okay. Complex chemicals, nanotechnology, non-ergonomic workstation design, and then your job stress, burnout, and exhaustion. Okay. So we need to know these. If you're asked on the exam, what kind of new and emerging occupational hazards do we need to worry about? Here's your list. And here's how we apply the epidemiological model into the workforce, right? Understanding the difference, the relationship between work and health. Okay, so let's start with your agent. Who's your agent? What are workplace hazards? I'm right here on figure 32.2. It's excellent summary of the epidemiological triangle with regards to occupational health. What are our workplace hazards? They could be 5 of them: biological, chemical, ergonomic, physical, and psychosocial. So those are our agents. Who's our host? The workers, right? The workers' families. And then the wild card is the environment. What's going on? what's influencing both internal and external in the environment? What's influencing these host and agent interactions? Okay. Okay, we need to know these too. Box 32.1. This is kind of a summary of the whole chapter. What are the categories? What are the 5 categories of work-related hazards? We need you to be able to identify these. Okay, what's a biological or infectious hazard? Well, that's your bacteria, your viruses, your fungi. Okay, maybe infected patients and contaminated body secretions that are passed on to others. What are your chemical hazards? Chemical hazards may be medications, gases, vapors, aerosols. And then your enviromechanical hazards, right? These are issues that potentially cause accidents, injuries, strains, or discomfort, right? Maybe inadequate lifting devices, slippery floors, workstation deficiencies. Then you have your physical hazards, right? What are you working with? Are you working with radiation, electricity, extreme heat, extreme cold, extreme noise that can cause tissue trauma? Those are physical hazards. And then I think we've seen psychosocial hazards really, really manifest in recent years, right? Stress, emotional strain, interpersonal problems, right? The occupational health nurse has got to be on top of, aware, and very dialed in with these psychosocial hazards. That's where we get all our workplace violence. So a lot of responsibility on the occupational health nurse, but those are the 5 categories of work-related hazards that we need to be aware of. Okay, and then it goes through each of these specifically. First, it goes through, oops, sorry. Okay, it goes through the host, the agent, and the environment. Okay, and here's something interesting. You don't need to memorize anything on table 32.1, but look at these selected job categories, what you may be exposed to, and what work-related diseases and conditions you might be at risk for. Really interesting. Okay. And here it goes through your 5 categories: biological, chemical, environmental and mechanical, physical, and psychosocial. If you want a little bit more information. Okay. Okay. These are box 32.2. Scope of services provided through an occupational health and safety program. Look at all the services that are potentially provided, depending on probably the size of your workplace, your available resources. But look at all the resources and services: health and medical surveillance, health assessments, retirement, return to work if you've been out with an illness, health promotion, health screening, employee assistance programs, case management, lots of different programs that occupational health teams do. Here's our levels of prevention, page 570. Right? So related to occupational health. So primary, provide education on safety in the workplace to prevent injury. We can all see why that's primary. Secondary, screening for hearing loss resulting from noise levels in a plant. Tertiary, let's say you have a group of employees that has diabetes, working with employees with a chronic diabetes to ensure appropriate medication use and blood glucose screening to avoid lost work days. Do we understand why that is tertiary? They already have diabetes. You're working on helping them with management of that, so they reduce their missed work days. Okay. Healthy People 2020. These are objectives related to occupational health, reduce deaths from work-related injuries, reduce non-fatal work-related injuries. It's all about the workplace. Reduce deaths from work-related homicides, reduce work-related assault. Okay, and then here's OSHA. Okay, I want to talk about NEOSH first. These are the two main organizations we need to know about. Box 32.3. Okay. NEOSH. That's the overall organization. They conduct research. They review research findings. They recommend levels, permissible exposure levels for occupational hazards. They do all the research, send everything to OSHA. They identify the health and safety hazards. They educate the occupational health and safety professionals. Right, so they do their research, they do their findings, and they distribute all that to the statewide OSHA organizations. And then what does OSHA do? OSHA is responsible for enforcing them. Okay, so OSHA is responsible for enforcing the occupational standards that have been set for them by the National Institute for Occupational Safety and Health. Okay, OSHA is the one who comes in and does work-related injury assessments, right? If every time you have a worker who's injured on the job, it has to be reported to OSHA. Okay, they have databases of work-related injuries, illnesses, deaths, right? They monitor your compliance with occupational health and safety standards. They enforce the national guidelines. So that's the difference between the two of them. Okay. And then your targeted competency here is your evidence-based practice. Right? We want to integrate the best current evidence with clinical expertise. Okay. One thing I want to go back and cover that I think I skipped over is doing a workplace assessment. Right? The nurse has got to do a workplace assessment. She's got to understand by her walking around and doing her windshield survey, what are the risks? What are the risks in the hospital? What are the risks in the nursing home? What are the risks in the car plant, wherever the work site is? Right? What's the education level? What's the safety training of the workers? What are the requirements of the various jobs? What do the various jobs have for actual or potential hazards? What are their practices? Are they careless? Do they follow the safety standards? Do they come to training when they're supposed to? Okay. So I'm just going to go through briefly this box is how to assess a worker and the workplace. right? You have to do a occupational health history with an emphasis on a workplace exposure assessment, job hazards, right? You must do a health assessment to identify any agent and host factors that are going to interact that potentially place the workers at risk. Right? You need to understand the work being done. What's the process for doing the work? What are the work-related hazards? Gather data about the incidence and prevalence of work-related illnesses and injuries related to those hazards. Like we said, conduct a walkthrough of the work environment. Right? And then try and examine the prevention and control strategies that are put in place for eliminating exposures. This is a really good case study. Do your case study in this chapter. It's good. 574. Okay. And that is what I want to cover in that chapter. So to have a better understanding of occupational health, big job for the occupational health nurse. And usually she has a team. I'm sure that wherever you guys work, that you have an occupational health department. Do you not? Probably do. So, all right, questions about anything we covered? Environmental health, epidemiological applications, and occupational health nursing. Let's go to your week 5 attestation. Let's do that. Tell me what the first question is, please. I can't remember from this afternoon.
It's what are the 3 elements of the epidemiological triangle?
Okay. Well, you guys should know that. What are they?
Host.
Agent, environment, and host.
Yep. And give an example of one. So the agent is, I don't know, bacteria, virus. Your host is somebody the agent has to infect,
Mhm.
right? And then your environment. Again, I call the environment the wild card because you don't know what's going on. Right? We talked about COVID infecting a school classroom versus a nursing home. Looks way different. Okay, so you've got your agent, your host, and your environment. Okay, the second question is we have to think back to our environmental, was it in our environmental chapter? No, it was in our, I think, occupational health chapter, that we have new and emerging risks in the workplace. We need to name 3 of those. What were they?
Complex chemicals, nanotechnology,
Technology,
job stress.
Burnout.
Burnout,
exhaustion,
stress. Yeah, what page is that on, Jabari?
563 in my book.
Okay, 563, that's your answer. I think you have 6 to choose from and it asks you for 3.
Uh-huh.
You guys have all that? Just hit submit so we can get this submitted for you and you don't have to think about it again. There's a method to my madness of why we do this at the end of every class. So we can do it together as a team and we can submit it so that it's one less assignment that you need to worry about getting submitted on time. And remember, if you don't submit it today, you have about 24 hours to do it. So by tomorrow night. Any questions? Any comments? I did say that I might have about 20 minutes of the gift of time to give back tonight. I know
How
you got
accurate were you?
pretty darn accurate. Pretty darn accurate.
I need to go play the lottery now.
Yes, I should. That is a great idea. And if I win, I'll share it with all of you. Okay, so that's what I have for now. That's all I have for now. I hope you guys have a great rest of the week. You know where to find me. Reach out if you need anything. I know you're all studying for a med-surg test. I get all that. The only thing I would ask you to do, maybe so you don't stress out too much, is in the next, it's only Monday, in the next couple of days, or even tomorrow, just pick up that study guide. All right, pick up this. Stop recording. Why? Am I supposed to stop recording?
Usually you do. I'm trying to be your reminder so you don't
Oh.
forget.
Okay, so I don't say something. Okay, all right, I'm gonna stop recording.